once they find a melanoma spot, they really are very careful to remove everything within the area.
It was just a small, flaky patch on her skin, but Lucy Puzo's sister demanded she see a doctor.
It was, in fact, malignant melanoma, level 2 invasion, and it was a very difficult time, as you would imagine, quite a shock.
Her bravery scar, as she calls it, sits where the cancer used to be. And it changed her habits and the habits of her kids. Shade, long shirts, and lots of sunscreen. She also gets screened.
Looks good, so we'll move to the one on the face now.
The MedCan clinic in Toronto uses a Canadian-made device called the Aurora.
It's a screening tool, and it tests in under 1 second a lesion, and it can tell you within 95% accuracy whether it's skin cancer.
It gives dermatologists and their patients added confidence when looking at moles and lesions. Skin cancer can be deadly. In fact, the worst type, melanoma, is on the rise. Skin cancer, unlike other cancers, is preventable. And doctors say that we're actually doing it backwards, that sunscreen should be last in our line of defense. Firstly, we should be getting out of the sun. Second, covering up. And third, using sunscreen on exposed body parts. There are different kinds of sunscreens, but the entire family can use the same one. There is debate, however, over SPF values. Technically, anything over 30, and the level of protection only increases a tiny bit. But
when the lab puts on an SPF 30, they do it very thick. So when we actually in real life put it on, we're usually putting on only about a quarter of what they did in the lab. So you're really only getting low numbers, like in the single digits, when you're putting on a 30. So we cheat a little bit and ask people to put on a higher number.
So there you go. They cheat a little bit, put on that higher number. But in addition to using sunscreen, you can also consider clothing. There is a UPF, or ultraviolet protection factor, when it comes to clothes. And you don't even have to go out and buy something special, Leslie. You can take, your shirt that you're going to wear with a long sleeve, hold it up to the light. And if you're holding it up to the light and you can see a lot of light through it, it's not going to give you a lot of blockage. So pick a different shirt, long pants, and it is a little bit cooler when you're actually covered up. So if you don't want to spend any money on these kind of special clothing, just grab what you have and take a look.
Big lesson for me was the amount you put on. I mean, you were literally covered in the white cream.
You load yourself up.
20 minutes to rub that stuff
in.
in.
That's why they kind of say, okay, yeah, 30 is good, but go higher, because we just don't use enough.
All right, good information as always.